Story 1. My doctor ignored my very vocal concerns about the pains and strange symptoms I was experiencing during my twin pregnancy. She missed all the classic signs of twin-to-twin transfusion syndrome, many of which I mentioned to her. As a result, I did not receive treatment in time to save them. I remember having to decide whether to bury or cremate them. Those were the darkest days of my life. Story 2. Not me, my mom. She had a Papa Nicolau test done, heard nothing, and assumed it was fine. Then, 2 years later, Mom had abnormal vaginal bleeding. She was fully postmenopausal and experienced bleeding for 6 weeks before her doctor did anything. Her doctor just put in a referral and said, no rush, I guess. Finally, she had enough pain to send her to the emergency room. They took some scans, and lo and behold, she had uterine cancer. She underwent surgery in less than 5 days, followed by chemotherapy and then radiation for the next 10 months. She had more unusual abdominal pain, and her emergency room doctor told her, you need another Papa Nicolau test, just to be sure. But what I want to know is, since your last test came back positive, why didn't your doctor do anything? It turned out she also needed a piece of her colon removed after her second test came back clear. Her colon had a severe infection that had been eluding her doctor for who knows how long. Anyway, question your doctors. They are people too, fully capable of being awesome or not. Story 3. I had a tumor in my colon. Over time, it grew and I suffered multiple symptoms because of it. My doctor dismissed my symptoms as premenstrual syndrome and female problems, even as they escalated. He told me to take Midol and get over myself, saying women either deal with their issues and move on with life or lie around whining and wasting people's time. Eventually, the tumor caused a complete bowel obstruction, and my body started to deteriorate from the inside out. I can't even describe how painful that was. I ended up in the emergency room, was sent for immediate surgery, and had part of my colon and necrotic tissue removed, along with a colostomy bag. I went from being a very happy, physically fit, and active person to whatever shell of a person I am now. Story 4. When I was in labor with my daughter, her heart rate would plummet with every contraction. Every time we questioned it, the nurse would tell us that it was just the monitor slipping. I went in at midnight, had a long labor, and was not examined by a doctor until an hour before she was born, around 2:30 p.m. the next day. By that time, she was in the birth canal and could not be delivered via cesarean section. She had the cord around her neck and was born blue and not breathing. They revived her, and she seemed to be okay. It was months later, when she wasn't hitting normal milestones, that we realized something was wrong. She has cerebral palsy and an intellectual disability. She uses a wheelchair and has to wear diapers. She will be 29 next month, and she still lives at home. We still have to care for her every need. I love her unconditionally, but I always wonder if that nurse had paid attention and gotten a doctor in on time, how different our lives would be. Story 5. After a bad fall, the doctor dismissed the foot pain as a sprain and only operated on the knee. The foot pain continued, but they said to wait until the knee heals because of insurance. If addressed at the time of the injury, insurance would have covered the foot. The end result was foot surgery a year later, but there is permanent damage that could have been fixed if they had addressed it immediately. Now I have a limp. I will never forgive them for their short-sightedness. I have summoned multiple 14ers, but I never will again. Story 6. Told me the lumps on my cervix were just scar tissue and he would contact me if the Papa Nicolau smear was abnormal. He never did, so I assumed everything was normal. Close to 2 years later, I was diagnosed with cervical cancer. Instead of having a rather simple cone biopsy to remove part of my cervix, I had to have chemotherapy and radiation, which put me into menopause in my early 30s. Story 7. When I was 13, I started having violent rapid heartbeats and hyperventilating, horrendous nausea, couldn't sleep, and was overheating all the time. It kept happening at school, and they decided I must be becoming a troublemaker and needed therapy. Me, the teacher's pet and gifted student who never had detention a day in her life or raised an eyebrow to an adult. They told my mother to just lock me outside to force me to get on the school bus until one day I genuinely thought I was going to have my chest burst open, and I begged my mother to help me. She drove me to school, and they told her I should be admitted to a pediatric inpatient mental facility. They kept me there for a month while I kept shaking, vomiting, and feeling like I was going to die. The doctor at the facility dismissed me as being overly anxious and attention-seeking. Nothing changed when I got out after a month. I can't even remember what triggered it, but I got someone to take my pulse, and it was over 200 beats per minute. They took me to the emergency room, tested me for drugs and other things. The attending doctor came in, took one look at me, and said to my mother, "Has her thyroid ever been checked?" No, because why would they test me when I was just seeking attention? It turns out I had severe overactive thyroid, the highest numbers that doctor had ever seen in a person under 21. She came back and told us, "I have first-year medical students who could have diagnosed this on day one. I was so overloaded with hormones my body physically could not eat or sleep, and it sent my heart into unimaginable rates of rapid heartbeat. I had to be put on adult-level doses of beta blockers to get my heart rate under control. I had actual damage from it being forced into that kind of beating for so long. I lost the ability to regulate it. They tried for 2 years to control my thyroid with medication. I was on the highest possible doses, and it was barely doing anything. So when I was 15, I had to take a massive dose of radioactive iodine to act as a lethal injection for my thyroid because they simply could not control it. And let me tell you, having to feel and go through one of your organs dying is horrible. Sucks so much. I was cold, fatigued, bloated, nauseous, sore-necked for 6 months until they tested my blood. And it didn't work. It didn't work. I had turned into a shadow of myself, was homeschooled, and could barely leave the house. I had to do it over again. If a second dose didn't work, I was going to have my thyroid removed. The second dose was worse, but it finally worked. I turned 40 this year. I still deal with rapid heartbeats. My pulse can flare up and go off like you wouldn't believe. It's very hard for my body to regulate. I have to be super careful about caffeine. That long history of thyroid issues left me with infertility, anxiety, and a lot of rage toward the medical community. Story 8. I had some pain in my mouth. Felt like it was radiating from my tooth. I went to my dentist about it, and she said, "Oh, you have a filling on that tooth. It's probably just a little sensitive." And she prescribed me some toothpaste. It worked for a while, but a year later, the pain was back with a vengeance. I went to a new dentist. It was the same situation. A year later, new dentist, same situation. Eventually, it got so bad that I was crying in pain. I woke every day with a horrible headache. My teeth were cracking and ground down because it hurt so much. Finally, I went to a new dentist, crying in pain, and she saw what she thought was a strange growth in my mouth. She had me get an exploratory root canal. The dentist who performed it, another one at her practice since she didn't have time and I wanted to do it quickly, told me that I was wasting my time and nothing was wrong with me. He changed his mind very quickly when he saw that I had a pus abscess under that tooth and all of my nerves there were completely dead. I have now switched dentists again to a woman who, when I said I was having pain, immediately sent me to a periodontist with no questions asked. Unfortunately, I still have to live with the cracked and ground down teeth and will likely have to wear a night guard for a long time. Story 9. I use the Veterans Affairs Clinic for all my health care. As a woman, when you get a Papa Nicolau test, the line is always, "We will call you if we find something." One of my tests was said to be normal, so I left and never received a call. I thought all was well. Then I changed doctors and the next Papa Nicolau test 2 years later came back abnormal. I requested copies of my previous Papa Nicolau test results from patient records, but they said they did not have them. Apparently, the lab sent my previous test results back, but no one had opened them, so they were not in the records. Finally, I got the records and the previous test also came back abnormal. I was diagnosed with stage 1 cervical cancer and had to have a hysterectomy, which means I can no longer have children. However, the claim for damages ended up paying for a house and my student loans. Story 10. It was an orthodontist who decided to straighten my initially not-so-bad bite and may not have been well qualified in maxillofacial orthodontics. As a result, this led to clicking, crunching, and pain. I have heard that many people experience similar problems. If anyone else has this issue, please let me know. A hug. Story 11. Let my mother, who had gestational diabetes and went overdue by almost 3 weeks, have a vaginal delivery. I weighed just under 10 pounds, and my mother is a tiny woman, about 4 feet 10 inches tall. I was completely blue at birth and was not expected to live. I have mild cerebral palsy caused by a lack of oxygen and head trauma from a forceps delivery. Both my mother and father definitely have post-traumatic stress disorder from the experience as well. Story 12. It started with a very loud ringing in my ear, followed by violent bouts of vertigo. I went to my primary care physician because I was sure I had lost hearing in that ear. I will never forget him saying, "28-year-old women don't go deaf in one ear. You're imagining things." He said he could refer me to a neurologist, but the wait would be 3 to 6 months. I paid out of pocket to see an ear, nose, and throat specialist, costing a couple $100s, who immediately ordered a CT scan. Thankfully, it was not a brain tumor but nerve deafness, which could have been prevented with steroids. Another disappointment, insurance did not cover the CT scan either. If you'd had a brain tumor, it would have been covered, but aren't you glad you don't? Story 13. My mom took me to the emergency room because of a high fever. I was diagnosed with pneumonia, and I needed antibiotics, so I had to see my primary care doctor. However, he dismissed my condition and said I did not have pneumonia. A few weeks later, the infection spread throughout both of my lungs and became very severe. My right lung was permanently damaged. I am now 33 years old, and this happened when I was about 12. Story 14. You have hemorrhoids. It's not. Have you heard of cognitive behavioral therapy? Starts doing cognitive behavioral therapy and reading philosophy. How much faith do you have in science? Fired by my doctor and received a passive-aggressive letter from the medical office assistants, where, funny enough, cognitive behavioral therapy could have been used. It wasn't hemorrhoids. It was stage 4 cancer. Left me without a doctor for a year, during which I almost died. The silver lining is I finally have a doctor who knows their field of expertise. Still waiting on the specialists. I might die between now and then, or I might be stubborn and stick around just to prove a point. Story 15. Putting me on an antidepressant as a child. They never investigated or suggested therapy. My home life was bad, and I didn't need a pill. I needed support and a better home environment. I have since spent most of my life dealing with the side effects and withdrawal symptoms from trying to come off the medication. Ironically, doctors continue to deny the reality of side effects and withdrawal being life-ruining. By the way, the drug I was prescribed was later removed from the market after lawsuits revealed false safety claims on children, and doctors didn't believe me when I said it made me suicidal, just as the lawsuit uncovered. So, the first doctor who prescribed it and every subsequent doctor after caused a domino effect of life-altering health consequences for me. I am not sure if they would admit to the mistake. Obvious disclaimer before anyone misinterprets. Yes, antidepressants can be helpful for some. Yes, they can save lives. Yes, some people have no issues with them. This is not about you. This is about those who were harmed by them and then gaslit by using those helped as justification. Two things can be true. These drugs help and these drugs kill. It is a sobering tension to hold. Story 16. The dentist at Aspen Dental told me that every tooth needs a root canal. I wasted years being afraid of the dentist, and it cost me a couple of teeth. Story 17. Not a doctor per se, but a chiropractor. I was 17, had fallen weirdly, and my lower back hurt badly. Doctors and others said to go to this chiropractor, and he would help once the x-rays and magnetic resonance imaging were in his hands. Well, he figured he could fix me before they arrived. Lo and behold, he ruined my lower spine forever because he would not wait. Turned out I had a torn muscle. Story 18. There were multiple doctors. When I was a child, I had recurrent urinary tract infections, and they never did any tests, just gave me antibiotics. They ended up having to remove my left kidney. I continued having recurrent urinary tract infections after the kidney removal, and the doctors who operated on me kept denying that anything was wrong. It was 3 years later when one doctor reviewed the exams taken 3 years prior and discovered I had urinary reflux, which is urine flowing back to the kidney repeatedly. He performed surgery, and I never had any more problems. However, I was left with one kidney with decreased function and a serious mistrust of doctors. Story 19. As a kid, I was always tired. I needed a nap after school and was too tired for afternoon recess. At puberty, I gained weight rapidly while eating almost nothing. My mom took me to the doctor repeatedly, begging for tests for anemia, thyroid disease, and mononucleosis. My high school had an epidemic one year. 2/3 of the students were sick with it. The doctor literally wrote in my chart, "Patient's mother worries too much," and filed the tests without signing off on them. When I was 20 and the Health Insurance Portability and Accountability Act passed, I got a copy of my records. You can watch my thyroid decline in real time over my teenage years. The test results were so out of range that by the time I saw another doctor, I received thyroid hormone replacement immediately. It was Hashimoto's thyroiditis. It turned out most of my family has it, but since we all saw the same practice in a small town, the doctor missed all of it. One family member's test results were so severe that the laboratory called them directly and advised them to go to the emergency room. They could have died or gone into a coma. It literally stunted my growth. I am the shortest in 4 generations now. I am over 40 years old and always cold except when I am having heat stroke. I have poor temperature regulation. I am still more tired than most people and gain weight too easily. I have tried different medications and adjusted lab values. Basically, having my first 20 years without enough thyroid hormones has caused lasting problems. New doctors wonder why I get copies of everything, check my medications at the pharmacy, and have zero tolerance for errors. Story 20. Tetracycline was prescribed to me as a child. I am not allergic to penicillin, and tetracycline ruined my teeth by turning them black. I already had a difficult childhood, but I never wanted to smile because of my teeth. I had veneers done in my 20s, but the damage to my self-esteem has been very severe. Story 21. My cat bit straight through the fleshy part of my finger on my dominant hand while I was trying to give him a pill. My own doctor was not on duty that day, but there is a walk-in doctor service at the clinic I go to. I had an appointment with a walk-in doctor who looked up the treatment for a cat bite using the medical reference system doctors use and prescribed me some extra-strength antibiotics. I asked her if she wanted to see the bite because it was not just a surface-level puncture wound. He had gone deep through the pad with his top and bottom teeth. She said no. I asked again just to be sure because I did not think that antibiotics alone would clear this up. But she sent me away without looking at the bite at all. 2 or 3 days later, the pain and swelling were getting so bad that I knew I needed to go back and insist that a doctor actually look at the bite. This time, I saw my own doctor. She took a look at it and immediately advised that I was going to need surgery and sent a referral to the specialist hand surgeon. She sent me home with more antibiotics and the strongest opioids I have ever been prescribed. I had the surgery and was sent home with strict care instructions, more antibiotics, and more opioids. The skin on my finger eventually healed, and I was able to stop taking the pills, but I was left with permanent altered sensation in that finger as well as chronic nerve pain that does not respond to traditional treatments. Could any of this have been avoided if the first doctor had just looked at the bite and seen how serious it was when I asked her to? I do not know, maybe not, but I will always be left wondering. Story 22. My 5-month-old son had constant watery eyes and a runny nose and cried non-stop as if he was miserable. I took him back to the doctor 3 times. The first time, he said it was just a cold and advised giving Tylenol for discomfort. The second time, he suggested it was probably allergies and recommended child allergy medication. The third time, he said, "Look, kids get runny noses all the time. It's common." A month later, I took him to a free clinic for vaccinations. That doctor immediately diagnosed my son with glaucoma and said he needed eye surgery to relieve the pressure. After 2 surgeries at Wills Eye Hospital, my son was 1,000 times better. However, during all those months, the medication the first doctor recommended worsened his symptoms and pain. It makes me very sad to know how much my baby suffered. Story 23. My obstetrician-gynecologist said I was touching my breasts too much and that was why I was lactating, even though I have never been pregnant before. It took 2 years and a nurse practitioner to figure out I had a brain tumor. Now, I will take medication for life. Story 24. deciding that I had depression and not attention deficit hyperactivity disorder. It took me 40 years to get attention deficit hyperactivity disorder diagnosed and treated. There are many heartwarming stories about starting life late and having a fantastic life. However, all that does is reinforce how little progress I have made, even as my theoretical best self. I cannot know if things would have been different with an early diagnosis, but I really wish I had that in my pocket to help manage my perception of what is personal failure and what are inappropriate expectations. Story 25. I had braces installed to fix my misaligned jaw and teeth, and they damaged the base of my teeth irreparably. My gums started turning deep red, occasionally bleeding and swelling. It was not good, and during my biweekly checkups, the dentist scolded me for supposedly not brushing my teeth properly and sabotaging the entire procedure. At one point, I was brushing my teeth 5 times a day with no improvement. I was eventually sent to have my teeth professionally cleaned every 2 weeks. My parents had to pay for it and were upset with me, despite knowing I was cleaning my teeth properly. The dentist performing the cleaning found it suspicious because no matter how well they cleaned, the swelling did not subside. She was helpful and suggested having an allergy test done. The dentist was unhappy but provided samples for a skin allergy test. However, she billed us for the samples out of pocket just like the cleaning, even though it was not part of the original procedure, so we had to pay. The result of the allergy test showed I was allergic to the glue or cement used to fix the braces to my teeth. The dentist did not apologize for not believing me and only said, "Well, we can't take them out. There's nothing we can do." I would have had to keep the braces in for about 4 years. I ended up canceling the entire procedure. The swelling of my gums trapped dirt that I couldn't brush away, which caused further damage to my teeth. The bases of almost all my teeth are badly damaged from that, and according to my current dentist, most of the damage to my teeth nowadays originates from the base. Story 26. Doctors and midwives did not care about my morning sickness when I was pregnant. I threw up about 6 to 8 times a day from week 7 and continued all the way into the delivery room. I am definitely not planning to have a second child. Story 27. My mom fell when she was 6.5 months pregnant. The on-call doctor tried to send her home, but she refused. He left her without care for most of the day while she contacted her doctor by phone. Her doctor organized care and traveled across the state to reach my mom. By the time he arrived, we were both in critical condition. My mom is emotionally scarred for life, and I have multiple disabilities, including vision, hearing, and physical impairments. Story 28. I had to have my spleen removed following a car accident. The doctor stitched through my intestines, leading to a severe infection. I almost died from the infection, and they had to open me again to remove large amounts of fluid from my abdominal cavity. They left the wound open to heal, and I had to stand in the shower at the hospital and gently press on my stomach from both sides to help expel the fluid. I still have a large hernia from it to this day and a significant scar. Story 29. Not a medical doctor, but an optometrist. I told them I had been experiencing some double vision. They told me I was probably tired or had consumed too much alcohol. Now, years later, I am considering potential eye surgery because it is too late for exercises to help. Story 30. One urologist just kind of laughed me off, to be honest. He was an experienced guy too. Thank God my general practitioner had a relationship with another urologist because that doctor saved one of my testicles. Story 31. I was born without irises. During cataract surgery, I had some rings implanted as artificial irises. Although they do not open or close, they limit some of the light entering the eye. Unfortunately, the rings were not properly aligned, and I now experience triple vision in the 1 to 2 o'clock area of my field of vision. I noticed this immediately upon waking after the surgery, but was told it would eventually settle. Apparently, my eyes are too fragile, and it is too risky to attempt a correction. This has significantly impacted my abilities, and I have lost much work because of it. Story 32. I was prescribed tretinoin for my cystic acne. The only instructions I was given were not to put it near my eyes. My dermatologist literally spent about 2 minutes with me after I waited for over an hour to see him. He did not explain anything about building up the frequency of use or the sandwich method. This was before tretinoin was very popular online and widely discussed. I was not warned about how drying or harsh it could be, and I was put on a high concentration right away because my skin was so bad. I did not put it near my eyes but noticed gradual and increasing eye pain and dryness. It got to the point where I would sit on my couch and sob because my eyes hurt so much. I told my dermatologist about it the next time I saw him, and he said it was completely fine and to keep using it because my acne was still severe. So I continued using tretinoin for 9 months. During this time, I saw 3 ophthalmologists, and finally, the third ophthalmologist told me tretinoin was damaging my tear glands and advised me to stop using it. I stopped, but my eyes never recovered. I have to use very expensive prescription eye drops and a nasal spray that stimulates tear production for the rest of my life. My eyes are still dry and still hurt. I will regret using tretinoin forever. The worst part is, it did very little to help my acne. It severely damaged my skin barrier, and ultimately, birth control fixed my cystic acne. Story 33. They told me it was probably nothing. It was cancer. Spread. Now I live with a ticking clock that could have been stopped early. Story 34. Not my story, but my dad's. His physician told him it was just a prolonged cold. In fact, it was aggressive prostate cancer. Only because my dad did his own research did he realize it might be cancer, and he had to pressure his physician to conduct tests. Due to the physician's delay, it had already spread and is now incurable, only treatable. The surgery also severely impacted his lymphatic system, and he has had sepsis several times as a result. My sister and I were still minors when it happened, and my father was already a single parent. The physician's mistake nearly cost my father his life and would have left my sister and me orphans. Fortunately, my dad survived, but he still struggles with cancer and the aftermath of the surgery. Story 35. My surgeon left me on the table under anesthesia for 12 hours to work on another patient. I woke up with permanent vision loss in both eyes. He never spoke to me after the surgery. He ruined my life. I am not allowed to drive, and my prospects of furthering my career have vanished. I have daily panic attacks because I am disoriented all the time. When I asked why this happened, I was told it was due to surgical anxiety, so it is my fault. Story 36. My mom had a stomach ache for a year. Her doctor told her to lose weight, go gluten-free, drink less alcohol, and eat less sugar as she was pre-diabetic. By the time she collapsed and they finally scanned her abdomen, the cancer had destroyed her pancreas and was affecting her liver. We had 17 more days with her. Story 37. I was overprescribed antibiotics when I was a very small child and had a very weak immune system. It absolutely damaged my gut biome, and every dentist who has ever looked at my teeth has asked me if I was on a lot of antibiotics when I was young because I have always had very little enamel on my teeth. As someone with a family history of irritable bowel syndrome, I did not stand a chance, and my teeth have been damaged since I was a child. I am managing irritable bowel syndrome as an adult, but the teeth problems have been difficult, and I am likely to need dentures before I am 40. My mother was mostly transparent about this when I was a child, but never liked talking about why she did not choose to join the several other families whose children were overprescribed medication by this pediatrician and do something about it. Instead, from what I understand, he was allowed to retire and we all ended up affected. Story 38. A failed lumbar surgery. I kept telling the surgeon something was wrong, but all I got was, "Oh, it's okay. That's normal." More than 35 years of living with level 6 or higher pain. Story 39. Pales in comparison to some of these, but they did not realize the grommets inserted during surgery had not fallen out more than a year after I had my tonsils removed. I got an ear infection, and due to complications related to both the infection and the remaining grommet, I ended up with permanent hearing loss. I have been largely deaf in one ear ever since. Cheers. Story 40. When I had my wisdom teeth removed, the surgeon accidentally nicked a nerve, so the right side of my lower lip and chin has altered sensation. For example, when I tap my chin, I feel it in my lip. However, considering the tooth on the other side was at a 90-degree angle, I am not very bothered. It has healed reasonably well since it happened, thanks to vitamins. Story 41. I heard a popping noise in my shoulder while at work moving boxes. I went on workers' compensation because breathing was hard and I was in pain. I spent the next year getting X-rays, magnetic resonance imaging scans, magnetic resonance imaging arthrograms, physical therapy, and other treatments. I was eventually diagnosed with a permanent injury, and my employer was supposed to cover any costs associated with my shoulder. It was frustrating because they ignored everything and denied that it was related to the workers' compensation claim. A few years later, someone said it sounded like I had a rib head out. I went to see her, and she was able to get the rib head back in, which really helped. However, the years of my rib head being out caused issues with my middle and lower trapezius muscles not activating, arthritis in my neck that required surgery, and I have been getting consistent massage therapy to manage my neck and shoulder issues. Doctors never diagnosed anything specific with my shoulder, but were happy to close the claim and just say it's permanent. I was in excellent physical shape, weighed 160 pounds at 10% body fat, and was very fit. They would say things like, "I wish I had that bone structure and fitness. Advocate for yourself." Story 42. Not one doctor, but a whole series. I was born with a mild form of spina bifida, but it was severe enough to leave a large scar on my lower back. Over the years, a tumor developed, and I had problems with urination. This worsened, and my parents tried to get a proper diagnosis from doctors, but they dismissed it as a psychological issue. Despite having a tumor as large as a third buttock and being far too small for my age, the tumor damaged the nerves to my bladder, causing incontinence and nearly destroying my kidneys. This almost caused my death. I had a urostomy and now have a urine collection bag for the rest of my life. If only one of the doctors had listened to my parents or examined me carefully. Story 43. My pediatrician thought too many children were having their tonsils removed prematurely and believed I would outgrow the issue. I had strep throat 17 times as a child, yet she still advised against removal. Interestingly, when I was in medical school, my ear, nose, and throat instructor was examining me and asked why I still had my tonsils. By that time, I had chronic strep throat and would develop bacterial infections whenever I caught a cold, stayed up too late, or drank alcohol. Dairy made me sick, and I frequently developed stones on my tongue. I had my tonsils removed as an adult, which made recovery significantly more difficult than it would have been as a child. I feel balanced now, but taking antibiotics so often could not have been good for my health. My parents regretted not insisting on the surgery earlier, but they trusted my pediatrician. My mother remains upset about it. Story 44. When I started experiencing leg pain in 2010, the first doctor I went to diagnosed it as tendinitis in my right knee. He decided the damage was too severe to refer me to surgery or physical therapy. He only recommended a leave for the pain, despite my history of acid reflux. It took 3 years to see another doctor in my hometown who diagnosed the pain as bursitis. I received injections in my hip every 6 months for another 3 years until he was fired for malpractice related to multiple knee surgeries. It took another year to see a doctor specializing in leg injuries. He ordered 6 weeks of physical therapy and MRI scans of my knee and hip. The MRI confirmed tendinitis in my knee and indicated a labral tear in my right hip. He prescribed a second round of physical therapy and stronger pain medication, prescription strength acetaminophen, to avoid worsening my stomach issues. After the second physical therapy session, he referred me to a surgeon who specialized in labral repairs. A few months later, I had surgery to repair my torn labrum and reshape my hip bone. My surgery was in 2017. I still have knee pain from tendinitis, but my hip is mostly pain-free except when exposed to cold. The cold makes the bone and scar tissue ache. I continue to do physical therapy exercises to improve mobility and flexibility. Story 45. I had an ongoing dull pain in my chest and back that eventually motivated me to see a doctor. He told me I was sleeping incorrectly and gave me muscle relaxers. The pain lingered anyway. 2 weeks later, the pain grew so intense I finally went to the emergency room. It turned out I had a thoracic aortic aneurysm. I was given morphine for the first time, and I understood why people get addicted to opiates. Soon after, I had surgery for stent placement in my artery. During the surgery, I experienced 14 embolic strokes. When I woke up, I realized I could not use my hands with any articulation. I ended up doing 5 months of neurotherapy just to learn how to walk smoothly and to be able to open a bottle of water, which was my own test. So no, the original doctor did not cause the aneurysm, but he certainly did not listen or investigate to a reasonable extent. I do not think doctors are magic or gods, but that was unacceptable. I used to be great at typing. This takes me 15 minutes now. My job prospects have diminished significantly. Story 46. I was treated for borderline personality disorder when it was clear that I am autistic, as is my mother, but no one cared enough to address it. Story 47. I had a dentist who thought I couldn't handle any intensive dental work, such as hygienist appointments, root canals, and major fillings. He lied that my teeth were fine regardless of how much I brushed or flossed. I spent 20 to 30 years unaware that I wasn't taking proper care of my dental health and had no idea how to care for my teeth. Then, when I got a toothache and went to the emergency clinic, I ended up needing a new dentist, months of appointments, and various remedial treatments. It also came out that someone else had sued the same dentist for not doing their job properly. Story 48. Not me, my son. When he was not quite one and breastfeeding, his mother's doctor prescribed an antibiotic tablet for a whitlow on her finger. I won't go into the symptoms beyond that he began to retain fluid alarmingly and started to get really sick. To cut a long story short, the tablet severely damaged his kidneys. A long stint in hospital and his mother being driven half-mad trying to keep his medications working at home ruined our family life to a large extent, with his older brother having to make do along the way. Why is the doctor at fault? 1. He knew she was breastfeeding and there was a chance something like this would happen. 2. It wasn't a whitlow. It was a bone cyst, which required an operation, not an antibiotic. I am very bitter and angry towards that doctor, but proving it would be almost impossible. It is 35 years later. So much of his life has been spent in and out of hospital. He had to go on dialysis for a long time until he was able to get a transplant. I wanted to be a donor, but his kidney specialist said no. Now that transplant is failing and some kind of blood cancer has appeared in the last few weeks, possibly the result of the immunosuppressants. And through it all, he has been a dad and soldiered on with a smile, trying to help me with my health, which is not the best. He is a true legend. Am I bitter? Yes, absolutely. Story 49. Not me, but my mother. She was complaining of difficulty breathing. She went to her general practitioner, who told her it was a result of constipation and that my mother should avoid dairy. My mother returned, saying she had modified her diet, but still had difficulty breathing. The doctor again said it was related to her diet. To be fair, my mother was slightly overweight but not obese. She took steps to improve her weight but continued to have breathing issues. She went back to the doctor, who repeated that she just needed to lose weight and stop eating cheese. This pattern continued for about 6 months. Finally, my mother became frustrated and sought a second opinion. This time, the new doctor believed her. They ordered some scans and found nearly a liter of fluid in one of her lungs. It was lung cancer, stage 4. It had already spread to other parts of her body. She passed away about a year ago after several years of treatment. With her new doctor, she had an excellent care team, and I cannot speak highly enough of them. Northwestern medicine, for those who are interested. She had a unique form of cancer driven by her genetics. They connected her with a leading researcher in her type of cancer. I often wonder what might have happened if the first doctor had believed my mother and taken the time to order a scan. My mother still would have died, but might she have gained a few extra months or years? Might she have lived long enough to see her eldest grandchild graduate from college? Who knows? Story 50. Misdiagnosis of herpes at 18. The doctor barely looked at me and did a cursory visual exam. She lectured me and had a medical student with her. I was so embarrassed and felt dirty. This was my first sexual partner. For years, I had to inform partners. I was terrified of spreading it. I lived at home at the time. Years later, I had another outbreak. I got tested and examined. It was not herpes. Story 51. Not me, but a coworker who does not use Reddit. She is admittedly overweight, probably over 300 pounds, but generally healthy. About 2 years ago, she suddenly started losing a lot of weight for no apparent reason. nearly 50 pounds in 2 months. She had not changed her diet or anything else about her lifestyle. You do not have to be a medical professional to know that sudden, dramatic weight loss without any lifestyle changes is a sign of a medical issue, so she went to her doctor. Her doctor did not see the problem. After all, she was overweight, and losing weight when you are overweight is good. Was she not happy to be losing weight? He paid zero attention to the context of the weight loss. His entire thought process was, an overweight person is now less overweight. This can only be a good thing. Thankfully, my coworker is a very stubborn person and immediately went looking for another doctor. She was able to find one taking on new patients on short notice. That doctor actually listened, agreed that her weight loss was concerning, and ordered a series of tests. It turned out my coworker's weight loss, which her first doctor insisted could only be a good thing, was the result of intestinal cancer. After surgery and chemotherapy, she is doing pretty well now. But if she had accepted that first doctor's opinion, she most likely would have died. Story 52. Born with congenital cataracts. I had surgery at approximately 1 week old to have them removed. The surgeon was not prepared for how difficult it would be, and I ended up with complications that progressed to glaucoma. Now I am fully blind in my right eye with a risk of losing vision in the left eye as well. Story 53. I was misdiagnosed and dismissed for over 30 years before a congenital brain abnormality was found compressing my brainstem. Even then, doctor after doctor, 5 neurosurgeons and 2 neurologists just to start, dismissed it as the cause of my scattershot neurological problems. However, by then my symptoms were so severe and progressing so rapidly that they at least recognized something was seriously wrong. I had surgery by a world expert on the condition 10 years ago, which gave me renewed life but left me with permanent disability. The brainstem does not tolerate decades of compression. Coupled with thick adhesions gluing the area shut over time, this resulted in a complete blockage of cerebrospinal fluid flow. I have permanent autonomic nervous system dysfunction affecting my cardiovascular, respiratory, metabolic, digestive, and musculoskeletal systems from the decades of damage. Story 54. About 10 years ago, a family friend experienced severe lower back pain and other symptoms, including blood in his urine. He went to a clinic, but the doctor dismissed him and advised him to take over-the-counter pain relief. A week later, he was hospitalized and diagnosed with stage 4 bladder cancer. The diagnosis came too late, and he passed away a month later, leaving behind a young family. It later emerged that the doctor had a history of poor performance in his work. Story 55. My mom got a new doctor when her previous doctor retired. She went to him complaining of pain in her shoulder and neck. He gave her a small amount of pain medication and sent her on her way. She went back a few weeks later. The pain was getting worse. The new doctor assumed my mom was addicted to pain medication, despite there being no record of that in her medical history, and sent her away. This continued for a few months, and the doctor never ordered any additional tests. Finally, my mom contacted her previous doctor, who arranged for her to get tests. Turned out she was in stage 4 non-Hodgkin's lymphoma. She lived for about 9 more months. Those months could have saved her life. Now I don't have a mom. Story 56. My wife felt a small lump in her breast when she was 29. It was small, but I could also feel it. She went to her obstetrician-gynecologist for her annual appointment a couple of weeks later and mentioned it. The doctor told her not to worry because of her age and lack of family history of breast cancer. We felt relieved. A year later, the lump was still there. She brought it up again, and they finally agreed to do an ultrasound and then a biopsy. Lo and behold, she had an aggressive form of breast cancer. When she had surgery to remove her breast, they also took some lymph nodes from under her arm, which were positive for cancer, meaning it had started to spread. If the doctor had taken it seriously a year earlier, the cancer might not have spread. We will never know. I do know that the last 8 years of treatment, from surgery, reconstructive surgery, chemotherapy, hormone therapy, and treatments to fight the side effects, have been hell. An expensive hell. Story 57. A psychiatrist told me she did not see a reason for me to take medication. I had suicidal thoughts, made a few attempts, and was barely holding on. If my last attempt for months after that visit had been successful, I would be long dead now. Story 58. Misdiagnosed mental health crisis as depression. Increased antidepressant medication by 300%, causing a major manic episode and a diagnosis of bipolar disorder. Story 59. Hip replacement. The doctor never measured my legs. The morning of surgery, he looked at my legs on the bed and estimated that I needed half an inch added. He was wrong. I had no bone loss, and now my left leg is half an inch longer because of him. I know this sounds mild compared to many other stories, but it is my experience and has been a nightmare for me. Walking long distances makes my shorter legs hip hurt badly. For those who live in Illinois, avoid the Illinois Bone and Joint Institute. They treat people like cattle. Story 60. The oncologist kept telling my father his cough was due to allergies and to take over-the-counter cough medicine. Several weeks went by. Eventually, he ended up in the emergency room by ambulance and was diagnosed with double lung pneumonia. He died 3 days later. The doctor was too lazy and dismissive to order a chest X-ray. Story 61. 7 doctors told me, "You are too young for this kind of pain," for almost 3 years. Finally, I found a doctor who believed me and ordered all the tests. My vitamin D was so low it would have been fatal in a couple of months. Luckily, I am alive. Unfortunately, I have permanent neurological damage, so I will be in pain for the rest of my life. Story 62. My eldest brother had braces when he was a young teenager, and they also put him on steroids for a chronic issue. This led to nearly all his teeth becoming some variation of rotted, which I believe contributed to his chronic depression and indirectly led to his death. My mother visited the doctor last year in March, saying she didn't feel well and struggled to breathe. Her heart was also beating irregularly. We later found out it was atrial fibrillation. The doctor said, "Well, we can put you on oxygen, but you look fine to me." By Thanksgiving, she was struggling to breathe just going from the living room to the bathroom and back. The doctor suggested it might be an upper respiratory infection and gave her about a week's worth of antibiotics. A month and a half later, she was in the hospital with severe pneumonia because her oxygen levels were in the low 60s. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.